Hi, my name is Dr. Ilya Skolnikoff. I'm excited, and this is Graciela Cruz. We're excited to be here today going over a few things about what do we do in the office to help people with their health. So Graciela has been very kind to give us permission to mention a few things about her health. She's having some trouble with her hair, with the hair thickness, with body weight or belly, you could call it belly fat, I guess, and some pain she's having on her heels at the calcaneus on both sides. And so these are all part of a pattern that we found is happening with her health. She's never been to a chiropractor before for one reason or another. She's also having a little bit of trouble with memory, mood, hair loss, quite a bit of trouble with hair loss, especially over the last 4 or 5 years, and a few other things. So we found that there's a bacterial infection we're wanting to get rid of, and everything's going well except we're having her, believe it or not, go out and get a new bra. I know it sounds bizarre, but if the person has the wrong kind of bra, it affects how well their body's able to have normal gait, meaning normal walking. And what happens is if the gait is abnormal, then there's all kinds of imbalances in the nervous system input going up to the head. So the person that tends to have trouble with their balance and everything. So we're actually going to do a couple of adjustments to help with thinking more clearly and help with this bacterial infection that seems to be in the colon of all places. So let's give it a go. Okay, go ahead and lie on your back and we'll do that. Okay. And then we could even do an emotional therapy and find out what emotion this might be related to. That can make the treatment more effective, and it just goes deeper. So I'm going to put this here for a second. Borrow your arm. I know those pills are still under your tongue. So for Graciela, the emotion would be related to the infection. Conflicted, fear of independence, fear of change, some other dominated, repressed dependence, pressure to succeed, have to do it all, inability to express self, fear of self-expression, silent scream. So it's a feeling of, those words, silent scream? Okay, does that make sense? Or okay, feel the feelings of silent scream. Okay, we're just going to help with that feeling she has a little bit. Was there an earlier time where there was a similar feeling of silent? I'm asking your body actually. Prior to conception. Could your mom have been really upset about things even before she was pregnant with you? Okay, yeah, you had mentioned a few things. So think of that. Okay, so scoot up a couple inches this way. Like I said, this is really surprising and kind of shocking. It might even be scoot down a couple inches, a little uncomfortable, but you'll feel much better later. And I have some homeopathic remedies to help. We have some dietary suggestions to help, but anyway, maybe we'll just do it a little bit more gently. Maybe that'll work better for you. We'll see what's best, but just it's gonna help you. Okay, so feel that feeling of that you might have had a long time ago. Even when your mom was pregnant with you, she might have been upset about a few things, and just think about how that might have affected you. We'll do this little adjustment. So yeah, there's a quick movement. It's a little surprising, but you'll be fine. Okay. So just think of that. Let your head rest in my hands, like you're asleep. Go to sleep. Go to sleep. Okay, go to sleep. Yeah, and like I said, there's a bit of a quick movement. Okay, you're thinking about what was happening a long time ago when your mom was pregnant with you. She might have been upset about a few things. Okay, good. Yeah, just think of that. Try to let this relax here as best you can. Okay, good. See, she loved it. Okay, so it's really surprising if you've never had a chiropractic adjustment before. And you can see, well, actually her face is getting all red, but I don't know if that's because of emotions or because of the improved blood flow and to her head and neck, but either way. How you doing? Okay. So feel the feelings of silent scream that you might have had actually throughout the course of your life, and that's a deep emotion, right? Anything that they might be related to, anything regarding family or friends or tension or anything, especially if it was, impacting things that would happen from day to day, like sleep, exercise, friendships, relationships with family, how you look at the world, or things that you eat or drink, or so this is everything, right? Just anything that's happening from day to day. And all right. And yeah, good. We're going to do a part 2 in just a minute. Thanks for joining in. This is Dr. Ilya with Thyroid Health. Stay tuned.